Hello, my name is Bailey Jones, and this is a presentation summarizing our intervention on positive thinking and mental health in urban cities by Desiree Marcano Ayala, Bailey Jones, Amy McClendon, Valerie Montes, Stacy Medina, and Alma Romo. Here is information about our team and our intervention. Our approach is to focus on intervention groups composed of clinical psychologists who will implement a system of positive psychology practices in the urban areas of our cities through psychological treatment. These psychologists will either be hired by the state on local programs for the community as well as by private institutions. The intervention will be executed by medical practitioners who refer the patients to the psychologist or by community volunteers who will inform those in need of their options for treatment and counseling. We will also be working with local schools so that they may refer students or families of students that appear to be struggling with mental health or other needs due to low SES. This intervention will target individuals that are classified as lower class in the socioeconomic society, displaced and unemployed individuals, and those who suffer from mental and social issues. We will also include people who lack adequate health care assistance due to financial and social hardships. The procedure for implementing this intervention will be providing a dynamic skill-based program that works closely with physicians, mental health counselors and doctors, nonprofit organizations, state and federal programs that offer assistance, training, and resources to the individuals, providing life skill lessons, coping skills for mental health, breaking socioeconomic barriers, and the different ways to access adequate health services for their family. The effectiveness of the intervention will be evaluated by generating desired outcomes and steps for the targeted individual that will be a part of this intervention. Monitoring the impact it will have on the communities by providing data analysis, positive and negative effects, and by setting monthly goals and achievement levels for success. In order to provide you with more information on how low socioeconomic status, or SES, affects children and their families, we put together some more information on this. Children belonging to low-income families are 3 times more likely to develop mental health disorders than children not living in poverty. Low SES has been found to be associated with a higher prevalence of anxiety disorders, depression, as well as low self-esteem. Although mental health issues such as these are relatively common among youth, it often goes under-recognized and diagnosed. It's important that people become more aware of these issues so that it can become more normalized and recognized so that it can be treated early on in life. Emotional and mental health is crucial in development, so support is necessary for children and families dealing with these issues. It is even less likely to be diagnosed or recognized in low SES families, which is another reason we believe our intervention is so important. According to a study that examined a database of 34,000 patients with 2 or more psychiatric hospitalizations in Massachusetts during 1994 to 2000, unemployment, poverty, and housing unaffordability were correlated with a risk of mental illness. Studies show that there is a clear need for the continued development of preventative and early intervention strategies that pay particular attention to the devastating impacts of unemployment, economic displacement, and housing dislocation, including homelessness. Studies also show that low socioeconomic status adults have many more stressors than higher SES adults, as well as more physical health issues, which adds more stress. This amount of stress puts them at a much higher risk for mental and emotional disorders. This then affects the children in the home. Children with this much added stress are more likely to develop mental illnesses as adults, if not as children. This keeps the cycle going. Some of you may be unaware that positive psychology is fundamental for the physical and mental health of the human being. And for those of you that don't know, positive psychology is the scientific study of positive human functioning and flourishing. This idea brings programs like ours to focus on how positive thinking can change the lives of those who are less fortunate or those who have a hard time getting out of a constant negative cycle, possibly due to their low socioeconomic status. The United States is composed of a large immigrant population with an increasing minority population that has been affected by strain due to unemployment, substance abuse, discrimination, and cultural conflict. One example that led us to creating an intervention of positivity is seeing how the Latino families face a variety of stressors that may impact positive parenting practices. Levels of acculturation and immigration affect family dynamics and parenting styles in unique ways. Difficult changes such as the impact of acculturation when moving to an unknown country and culture creates greater tension in the family. This can lead to familial emotional separation, stress, anxiety, and even depression. From this perspective, we adopt positive psychology and how it focuses on many dimensions at the individual level, the subjective level, and the social level. Our approach is to develop a way for our society to work together, focusing on inner and urban cities where the socioeconomic status, or SES, is very low, as well as positive thinking and mental health. On a social level, our goal is to help create and maintain healthy families and programs of positive thinking, which include problem solution ideas for parents, young adults, and children. We also hope to influence more positive home and work environments and maintain an open chain of support for all of our citizens, which is something that has not been easy for them to access up to this point. We gathered most of our information from previous research we studied. When we look for the best way to explain the benefits of our positive psychology intervention, we first look at theories like social learning theory and strain theory. These social theories see the individual and how they gain their negative behaviors and poor mental and physical health based on past social experiences and life difficulties, which are all in conjunction with low SES. This provides us a baseline to best approach the intervention participants. Together, these theories imply that change is possible, and we want to use them to promote and teach positive psychology in low SES areas to provide the best treatment. Research shows that in the past couple of years, positive psychology has shed light on the way to help people live more fulfilling lives by focusing on human strengths. This field is interested in what people do right, what is right with human beings, and is interested in building on those strengths. This is what we will be focusing on implementing into our patients' treatment plans for this intervention. Here are some possible challenges and ethical considerations. Some of the barriers we may face include financial barriers, stigma and discrimination to treatment, cross-cultural counseling barriers, and mental health system barriers. We are aware that primary care has become a critical setting for mental health detection. This is why we aren't limiting our approach to clinical psychologists, but to medical practitioners as well. Lack of medical attention usually results in a lack of mental health attention and awareness, especially in Hispanic and minority communities. Ethical considerations have an important role in psychology and psychological implementation. Licensed psychologists and medical professionals are well versed in the area of ethics and practicing within their field. In their roles as therapists and consultants, informed consent is a central principle and will always be required. The client's participation is completely voluntary and can be terminated at any given time of service. The ethical principle of do no harm is a standard in this field and within our program. This states that our licensed professionals will strive to care for their clients and do no harm. With this comes the acknowledgement that clients receiving psychological treatment have the right to expect competent professionals. Professionals are required to openly discuss their capabilities within the services provided and make recommendations to other resources when that level does not meet satisfactory standards with the client. Practitioners facilitating these services must have the necessary coursework and stay up to date on professional development, readings, and findings. Ethical considerations of confidentiality are also to be followed, with exceptions to mandated law and court decisions. Some implications of this intervention include the potential impact on public health within a community that has little to no access to mental health resources. Changes at the community level can result in larger benefits for the surrounding population. Policy changes advocating for funding within these vulnerable communities could enact change and destigmatization over the issue. Normalization and awareness of mental health issues in the community. There are many potential benefits of practicing positive psychology, including an increase in self-esteem, improved relationships, and a greater outlook on life. Research in the realm of positive psychology has found that gratitude, social connection, and kindness are all important to living our best lives. Positive psychology also lends itself to improvements in the workplace. Studies from the field have found that positive emotions boost our job performance. They also, in the workplace, are contagious, which means one positive person or team can have a ripple effect that extends through the entire organization. Small, simple actions can have a big impact on our happiness, meaning that it doesn't take much to encourage your workplace to become a happier and more positive place. It's so important that we work on these communities where low SES has a big impact on mental health, stress, and anxiety. By focusing on helping these areas in need, we hope to create that ripple effect where these communities start the initial steps to creating a flourishing life. If these families, parents, and citizens start implementing more positive actions and thoughts into their lives, focus on their strengths, and start changing their routines, parenting ways, and enthusiasm in daily life activities, we should start seeing overall improvements and mental health in the community. We predict that this will help people to start looking for better jobs, education, and work environments. We also hope that our intervention can help normalize and bring awareness to mental health issues in the community and beyond. If the participants work with our psychologists and health practitioners, continue their visits, do their assigned homework and activities, receive coaching for better parenting habits, and find ways to improve their relationships with their children, or even if they start a new healthy activity that brings them peace and moments of mindfulness, we will have reached our goal. We hope to set a standard, to teach them that even in times of adversity and moments where they feel that they can't spare 1 minute of their lives to themselves, maybe if they stop for a minute, they will see that to think of something good in their life might be a starting point to better mental health and well-being. We are aware that within these communities there are a lot of people lacking positive life habits because of their circumstances, or because they haven't had the opportunity or knowledge to improve. We know that many of these families are in great need of support, financial help, better home environments, and better opportunities in life. But our goal is not to just change their current circumstances for them. Our goal is to teach them ways to make positive changes in their everyday lives, to better help them open their eyes to possibilities they maybe thought they couldn't attain or achieve before. For measuring the effectiveness of the program, we will be using a qualitative approach to seek the positive, negative, or neutral results of the intervention. We will design patient surveys. They will be provided before and after the period of treatment is in place. These surveys may be anonymous based on the desired preference of the individual being treated. In addition to survey information, we will seek quantitative data results from the clinician and practitioner's perspective on how the intervention is working on their patients or participants. If surveys and professional documentation are not effective, a collaborative study conducted over the phone, in-person interviews with the individuals, and fieldwork can be used as a possible approach as well. This information will be confidential, and only consented information about the patient or participant will be used to analyze the quantitative and qualitative data collected. Funding is one of our greatest obstacles. We need to help our government and our city officials see the importance of positive mental health habits and how they can positively change the lives of the citizens and the community. A household where motivation, good mental health, and finances are lacking is a home that might be more inclined to seek help from the government instead of being able to seek help elsewhere. Healthy minds bring motivated citizens and citizens that might be willing to change their lives as well as their own communities. We cannot emphasize enough how important it is to address these issues in the community and to receive government grants for better health care in the state and to supply the cities with mentorship programs, future career opportunities, and educational services. It's not all about the money for our program, but how our program can open doors for the community. Many state programs offer student loan repayment programs for those willing to dedicate their initial years after college in low SES urban areas. This is the initial step the government can take to help us get qualified and willing clinical psychologists to reach the community. Other sources of funds will be accessed by informing private organizations or private clinical offices of how our program can also help provide training positions to their interns, and by working with the community and the cities, they might get some tax cuts and benefits. We will also have fundraising events where we will inform cities and communities of our work. We will explain the benefits of positive psychology and how we not only focus on treating the negative aspects in our patients' lives, but how to enhance the good in them. This will attract informed people to seek care and seek help, which will provide the cities with proof of how the people are in need of psychological support. We hope to receive a number of sponsors and groups that will be willing to help us grow. Community churches will also be provided and educated with our work, and they would then be able to refer their members or anyone they might know that is struggling to our intervention sites and support groups. We plan to start lobbying for city official support in January of next year, informing the community of our work and goal, talking with urban city physicians and private sector institutions about how they can sponsor our program and how we can help each other out in educational ways by providing mentorships. This is when we will start to reach out to community churches and put out information on social media and reach out to schools as well. Usually, we see that doctors who work with Hispanic communities or other minority groups are very interested in the well-being of all, which will be to our advantage in this process. We also have possible funding by the National Institute of Mental Health. The NIMH has funded many centers by funding their clinical research. Another possibility for funding is the Federal Office of Rural Health Policy, or FORHP, and administers community-based grant programs that target rural communities. Many of the grant programs require applicants to form or already be a part of a network of 3 or more organizations and be located in a rural area. I would now like to introduce our team that brought this idea to life. Again, my name is Bailey Jones, and I helped with the planning process, the review of related interventions, as well as coordinating. Next, we have Desiree Marcano Ayala, who came up with the brilliant idea behind the program, as well as playing a huge role in planning and coordinating every step of the way. She provided the introduction with detailed rationale for the program, and she helped pull everyone's ideas together, as well as helping with the timeline, budget, and other areas. Next, we have Amy McClendon, who helped describe who this intervention is meant for, the procedure for implementing, and how we will evaluate if it is effective or not. Next, we have Stacy Medina. Her roles included helping with the timeline and budget. Next, we have Valerie Montes, who addressed potential barriers and risks, ethical considerations, and implications of the project. And lastly, we have Alma Romo, who helped with the method section. We have listed all of our references used on our findings. Thank you for viewing our presentation.